We're living in this golden age of medical science. We've got gene therapies, personalized medicine, treatments that seemed like science fiction just a decade ago. But here's the weird thing. For all that incredible progress, the biopharma industry is wrestling with a huge paradox. The science is soaring, but the financial returns, they're often plummeting. This is what we're calling the Great Biopharma Decoupling, and we're about to dive deep into how it all works. All right, so here's our game plan. First, we'll tackle that central paradox. Then, we're going to look inside what's called the discovery trap. It's where brilliant science can actually turn into a financial nightmare. From there, we'll explore two incredibly powerful business models that are just capturing value like crazy. And finally, we'll see how new government policies are basically hitting the accelerator on this whole trend. So the common sense idea seems pretty straightforward, right? If you want to make money in biopharma, you invest in the companies that are actually discovering the next miracle cure. It feels right. You bet on the scientist, you bet on the molecule that's going to change everything. But what if that's the absolute worst place to put your money? Yeah, that's the number you're looking at. Negative 54.6%. That is the average return on invested capital for the entire biotech industry. Let that sink in. It's not a typo. For every single dollar put into this sector, on average, the industry is actually destroying value. So the big question is, what on earth is going on here? Okay, this brings us to what you could call the discovery trap. And this is where that amazing, world-changing science collides with some really, really brutal financial math. The main idea here is that the very act of discovering a new drug, the thing we all think of as the grand prize, is often just a financial black hole. So in the tech world, we all know about Moore's Law, right? Things get twice as fast and half as expensive. Well, biopharma has the exact opposite. It's called Room's Law. And yes, that is literally Moore spelled backward. It means that even with all our amazing new technology, the cost of developing a new drug doubles about every 9 years. It's wild. R&D productivity is actually going backward. And this is the brutal math behind that law. On average, it costs over $2 billion to get a single drug to patients. And why? Because you're not just paying for the one success, you're paying for all the failures that came before it. When you have a success rate of less than 12% from the first human trial to launch, well, the R&D lab effectively becomes a place where capital goes to die. So if the gold miners, the ones actually discovering the drugs, are losing money, who's winning? Well, it's the companies selling the picks and shovels. These are the folks building what we're calling the bioprocess fortress. And believe me, they are capturing value with an efficiency that is just stunning. So here's what happened. There's been this massive shift in how we actually make these complex drugs. We've gone from these giant, inflexible, custom-built stainless steel factories to these smaller, modular, single-use systems. And this is a total game changer. It lowers the risk for the drug maker, for sure, but the really critical part for our story, it flips the business model for the suppliers into a beautiful, high-margin, recurring revenue stream of selling disposable parts. And here is the secret sauce. It's something called regulatory lock-in. See, when a company's developing a new drug, the specific tools and filters and bags they use get written directly into the official filing with the FDA. Once that drug is approved, it is unbelievably difficult and expensive to switch suppliers. You'd literally have to go back to the FDA for reapproval, and nobody wants to risk that. So what does that regulatory lock-in create? It creates one of the most powerful business moats you will ever see. You get a company like Danaher, which can command over 80% market share in some of these critical components. Once their product is spec'd into a blockbuster drug, that's it. They have a guaranteed, super high margin annuity for the entire life of that drug. It's incredible. Now, let's look at another model that's maybe even more efficient. What if you could get a piece of a blockbuster drug's success without ever going near a lab, a factory, or a single clinical trial? Well, welcome to the world of the Royalty Clearinghouse. This is Royalty Pharma, and their business model is as simple as it is brilliant. They go to universities, small biotechs, even big pharma companies, and they buy the future royalty streams of promising drugs. They give them cash today for a cut of the sales tomorrow. They're basically a highly specialized bank for the industry, and in doing so, they completely sidestep that discovery trap we talked about. Or take a company like Halozyme. They have this patented tech called Enhanze. And what it does is it turns a drug that used to take hours to get through an IV drip into a simple shot you can get in 5 minutes.
So the big pharma giants line up to pay Halozyme to use this tech with their best-selling drugs. And Halozyme just sits back and collects a royalty on every single sale. It is a pure toll booth on someone else's superhighway.
And this slide, well, this is where it all comes together. Just look at the contrast. On the far left, you have that massive value destruction of the biotech sector as a whole. And on the right, the jaw-dropping profitability of these enablers. Halozyme with a nearly 48% net margin. Royalty Pharma with a mind-bending 92% EBITDA margin. This is the great decoupling in black and white. Scientific discovery on one side, financial value capture on the other. So you might think this is just a market trend, right? But it's not. This decoupling is actually being put into overdrive by huge policy changes and a giant threat looming over the industry. Let's look at how this new reality is basically cementing the shift we've been talking about. First off, the industry is staring down the barrel of what's being called Patent Cliff 2.0. A massive wave of blockbuster drugs are all about to lose their patent protection around the same time. We're talking hundreds of billions of dollars in yearly revenue just at risk. This puts enormous pressure on big pharma to find new drugs and new efficiencies, which makes the models we just discussed even more attractive. And then the US government passed the Inflation Reduction Act, and it was a true game changer. All you really need to know is there are two basic kinds of drugs. You've got small molecules, those are your typical pills, and you've got biologics, those are the complex injectables made in the factories with the single-use parts. Well, the new law gives biologics 4 more years of protection from government price negotiation than pills get. It's a massive structural incentive baked right into the law. And the effect wasn't theoretical, it was immediate. We're talking funding for new pill-based drugs dropping by as much as 70%. More than 3/4 of venture capital firms say they're shifting their money to biologics. The same number of pharma companies are planning to just cancel their early-stage pill programs. This policy, this pill penalty, is actively forcing the entire industry right into the arms of that bioprocess fortress we just talked about. So, it leaves us with this really fundamental question. As we look at the future of this incredible industry, we have to ask ourselves, where is the real durable prize? Is it in owning the next miracle molecule, or has the game completely changed to owning the regulatory-locked, capital-light process that brings all those molecules to life?